The mainstay of treatment for PCD is a combination of physiotherapy, which really requires to be done on a daily basis, and antibiotics to treat and combat infections. Now, these infections might be common or they might be recurrent and cause exacerbations. The role of antibiotics in PCD is really very important. There is very clear evidence that leaving untreated infections in a set of lungs where PCD is the cause of their lung disease will cause the accumulated secretions to build up, become infected, and cause chronic and irreversible lung damage. And so we have a very clear policy on how we use antibiotics. We never treat for less than 2 weeks when we're giving a course of oral antibiotics for a chest infection, and that might be because the patient has become much more symptomatic. The colour of their sputum has changed, it's become green from being yellow or creamy before, or they have other overt signs of infection. Now, we always culture their sputum, but we would nearly always treat before we had the results of those culture tests back, and we would always continue the treatment for 2 weeks. The reason for this is that in a PCD set of lungs, the cilia don't do the job properly. It's much harder to remove the secretions, and so it's very important that we assist with that by treating any infection. We therefore communicate this to all of our GPs and physicians that we share care with, so that we hope it is easy for the patients to get access to at least 2 weeks courses of antibiotics. The same sort of situation will exist when they need to come into hospital for treatment, in that we will nearly always give them a 2-week course of intravenous antibiotics, some of which will be done in hospital, and in some patients who have regular courses like this, they can go home and complete the course at home.